इंपॉर्टेंट क्वेश्चन MCQ ने इंपॉर्टेंट देख लेने फर्स्ट क्वेश्चन द क्लाइंट इज रिसीविंग टोटल पेरेंटल न्यूट्रिशन मीन्स TNP विच लैब टेस्ट should be evaluated while the client is receiving TNP. So client is receiving total parental nutrition. Which lab test should be evaluated? It's a hemoglobin, creatinine, blood glucose, white blood cells. So when client is receiving total parental nutrition, so blood glucose should be evaluated while receiving client is receiving TNP. So blood glucose is the right answer, option C. Next, move to the second question. The client is receiving peritoneal dialysis. If the dialysate returns cloudy, so nurse should document the findings, send a specimen to the lab, strain the urine, obtain a complete blood count. So when client is receiving peritoneal dialysis returns cloudy, so nurse should send a specimen to the lab. Option B is the correct answer. Next, move to the third question. The client is cirrhosis of the liver is receiving lactose. The nurse is aware that the rationale for the order for lactose is options ने to lower the blood glucose level, to lower the uric acid level, C to lower the ammonia level, next D to lower the creatinine level. Client is cirrhosis of the liver is receiving lactose, then nurse is aware that the rationale for the order for lactose is to lower the ammonia level. So option C is the right answer. Next, fourth, which of the following roommates would be the most best for client newly admitted with gastric resection? A client with Crohn's disease, client with pneumonia, client with gastritis, a client with phlebitis. So answer is option D, client with phlebitis. So which of the following roommates would the nurse for client newly admitted with gastric resection? It's a client with phlebitis. Option D is the correct answer. Next, move to the fifth question. So fifth question is, the nurse is preparing a client for mammography. To prepare the client for mammograph, the nurse should tell the client, restrict her fat intake for 1 week before the test. B, to omit creams, powder or deodorants before the exam. C, that mammography replaces the need for self breast exam. Next, D, that mammograph requires a higher dose. So nurse is preparing a client for mammography. To prepare the client for mammograph, the nurse should tell the client is to omit creams, powder or deodorants before the exam. Option B. Next, question number 6. Which client can best be assigned to the newly licensed practical nurse? A, client receiving chemotherapy, the client post coronary bypass surgery, C, the client with TURP, D, the client with diverticulitis. So client can be best assigned to the newly licensed practical nurses. Option D, the client with diverticulitis. Option D. Next, question number 7. The nurse is assigned to care for an infant with physiological jaundice. Which action by the nurse would facilitate elimination for the bilirubin? Increasing the infant fluid intake, maintaining the infant body temperature at 98.6 degree Fahrenheit, minimizing tactile stimulation, decreasing caloric intake. So right answer is option A, increasing the infant fluid intake. Option A. Question number 8. The nurse is making initial round on client with C5 fracture and crutch-filled tongues. So which equipment should be kept at bedside? A pair of forceps, a target wrench, a pair of wire cutters, a screwdriver. So nurse is making initial round on a client with C5 fracture and crutch-filled tongue. So on the bedside should we keep a target wrench? Option B is the right answer. Next question number 9. Nurse is caring for a client with epilepsy who is being treated with carbamazepine. Which laboratory value might indicate serious side effect of this drug? Uric acid of 5 mg and hematocrit rate of 33%, WBC 2000 per cubic millimeter, platelets 150,000 per cubic millimeter. So the right answer is WBC 2000 per cubic millimeter. Option C. Next, go to the 10th question. A client has rectal cancer and schedule for abdominal perineum resection. So what should the priority nursing care during the post-operative period? A. Teaching how to irrigate the ileostomy. B. Stopping electrolyte loss in the incisional area. Encouraging a high fiber diet. Facilitating perineal wound drainage. So option D, facilitating perineal wound drainage. Option D is the correct answer. Next, 11th, the nurse is caring for a client with laryngeal cancer. Which finding asserted in the health history 13? So would be not common for this diagnosis? Full breathing, dysphagia, diarrhea, chronic hiccups. So option C, diarrhea. Next, 12th, the nurse is performing an assessment on client with possible pernicious anemia. So which data would support this diagnosis? Weight loss of 10 pounds in 2 weeks, complaints of numbness and tingling in the extremities, a red beefy tongue, a hemoglobin level of 12 gram. So nurse is performing assessment on a client with possible pernicious anemia. So which data would support this diagnosis? It's a red beefy tongue. Option C. Next, 13th, a client is admitted to the acute care unit. Initial laboratory value reveals serum sodium of 170 milliequivalent into DL, but behavior changes would be most common for this client, and anger, mania, depression, psychosis. So option B, mania, is the right answer. Next, 14th, the nurse recognized that which of the following would be most appropriate to wear when providing direct care to the client with the cough? Mask, gown, gloves, shoes cover. So the right answer is mask. Option A. Next, 15th, a client with pancreatitis has been transferred to the intensive care unit. Which order would the nurse anticipate? Blood pressure every 15 minutes, insertion of Levine tunes, cardiac monitoring, dressing changes 2 times per day. So insertion of Levine tunes. Option B. Next, 16th, which laboratory test would be least effective in making the diagnosis of myocardial infarction? AST, B troponin, CKMB, next D myoglobin. So which laboratory test least effective in making the diagnosis of myocardial infarction? So answer is AST. Option A. Next, 17th, the first exercise that should be performed by the client who has mastectomy: walking the hand up the wall, sweeping the floor, combing her hair, squeezing a ball. So first exercise should be performed by the client who had mastectomy is squeezing a ball. Option D. 18th, a 25-year-old male is brought to the emergency room with a piece of metal in his eye. So which action by the nurse is correct? Use a magnet to remove the object, rinse the eye thoroughly with saline, cover both eyes with paper cups, patch the affected eye only. So option C, cover both eyes with paper cups. Option C. Next, 19th, the schizophrenic client has become disruptive and requires selection. So what staff member can institute selection? The security guard, the registered nurse, the licensed practical nurse, the nursing assistant. So the right answer is the registered nurse. Option B. Next, last question you can answer in the comment section. The physician has ordered a culture for a client with suspected gonorrhea. Nurse should obtain which type of culture? Blood, nasopharyngeal secretion, stool, genital secretion. So this question you can answer in the comment section. Okay guys, take care.